So tonight I've been asked to speak on the topic of the older the better. And of course, as a fertility specialist, I'll be talking more from the fertility perspective. I'll just acknowledge that I'm representing both Repromed and Flinders Fertility and the Flinders University tonight. Now, I'm going to divide my talk into two parts. The first 5 or so slides, I'm going to give a bit of background on why fertility diminishes as you get older, and then I'm going to address the issues that Maria faces. So, look, this trend of having children later and later in life has really been existing for a number of years now. Ever since the early 70s, throughout the Western world, there's been an advance in the average age of women. Such now, when I was a babe, the average age of a mother was 23, and it's now approaching 31 years. And interestingly, within the professional class, so the women who have a tertiary education, 1 in 4 women will still not have had a child by the time they're 45 years of age. Now, half of that, it's because they elect not to have children. Not everyone wants a child, but in the other half, it is an involuntary choice. Now, why are couples or women delaying having kids later and later in life? I think this is probably pretty obvious. There's an element of a career. I mean, certainly having children can stymie the career a little bit, and women are wanting to advance their career, which is entirely natural. There's an element of having a double income, no kids, high disposable income. That's fun. You get to travel a lot, and children certainly can be time consuming. I know that, having 4 of them. There's an element, I have a lot of women say to me, oh look, I can't get my husband, my partner to commit. Commitment phobia seems to be quite prevalent amongst the male population. And then finally we have Lisa Curry and others who, front page of the New Idea, my IVF baby at 51. It gives this perception, there's a perception out there, look, you can leave it until very late, and if it doesn't happen naturally, well, you've always got that parachute called IVF. And I guess that's true if you're willing to go to donated eggs, but it isn't true that you're going to have success at 51 using your own eggs. And that's where the majority of these stories, they don't point out that it's donor egg. So, when does fertility decline naturally? It's actually quite a difficult question to answer from a scientific perspective because there are lots of variables here. I mean, there's obviously the male factor, whether she's got open tubes, ovulates, and also simple things like coital frequency. You know, the older a woman gets, the longer the relationship, the reduction in coital frequency. So this particular study from the New England Journal looked at getting rid of those confounding factors. It was a study from France where they looked at donor insemination. So all the men had no sperm. The husbands had no sperm. They used top quality donor sperm, and all these women were known to have open tubes and to ovulate. And you can see that fertility is pretty good up until 30, but from then on it starts to decline. So the evidence suggests that fertility is pretty good up to 30, and then it starts to spiral downwards. Another way of looking at this natural fertility is a population called the Hutterites. These are a religious sect that lives in northwestern United States and Canada. And they're interesting because they get married very early, they never use contraception, and they live in a communal setting where everyone's cared for equally. So there's no financial disincentive to have kids. So they're a good natural model of fertility. And the average Hutterite woman has 10 kids. Sounds like fun. And the incidence of infertility is very low, 1.8%. You know, in our community it's 15%. So it's very few women can't have kids in this population. And you'll see from the graph on the right that looking at this, the fertility starts to drop even from the mid-20s. So, you know, we're not meant to be reproducing in our 40s. That's not the natural process. What's also interesting is the average age of a Hutterite woman who's been previously fertile to have her last child is 41. So half of women who've never had a fertility issue before will stop having kids at 41 because they've run out of good quality eggs. And that's an important point. There's been lots of studies around the world that's looked at this, at various populations that don't use contraception. And the average age where the woman has her last child is about 40 or 41. So there's a 10-year disconnect between when fertility runs out and when menopause occurs. And this is a very important point. Most people think that while they're still getting a period, they've still got eggs and they're still fertile. And the reality is that's not the case. Even doctors, a lot of doctors believe this. Now, why does fertility reduce with age? Well, this graph on the left shows you that it's an egg issue, not a uterus problem. Okay, so this is data from the US looking at IVF success rates. Now, if you look at the top line, that's the success rate according to the maternal age when you're using young donor eggs. So like a woman of 50 still has the same pregnancy rate as a woman of 25 if you use eggs from a 22-year-old donor. Yet, if we use her own eggs, you can see how precipitous the drop-off is. So it's suggesting it's not the uterus that's aging, it's the ovary. Okay, and the problem is depicted on that right picture there. This is the meiotic spindle, the meiotic genetic division process. At ovulation, the chromosomes are separated, and that process breaks down as you get older. And as a result, you have an increase in genetic abnormality in the embryo and a decline in fertility. So the graph on the left shows that we all know the miscarriage risk skyrockets as we get older and the fertility drops. And the table on the left shows the risk of having a live birth child with Down syndrome at various ages. And you can see at Maria's age of 45, that's a 1 in 30 risk if she doesn't have any screening or selective termination. So that's quite a scary risk. So I just want to point out that IVF, unfortunately, is not a perfect cure for this age-related infertility if you exclude donor egg. And the reason for that is twofold. First of all, as a woman gets older, the proportion of embryos that are abnormal increases. So this graph on the left is a study that looked at 15,000 embryos, and they found that by the time a woman hit 42, 90% of her embryos were genetically abnormal. 90%. So you've only got a 1 in 10 chance of making a normal one. And when you compare that also with the problem of, as you get older, the number of eggs that we retrieve in IVF declines, it's a double whammy. So not only do you have less eggs to play with, but more of them are abnormal. And of course that means success rates plummet. So, how do we deal with a problem like Maria? I am a fan of the Sound of Music. I guess I thought there's a few issues to raise with this. The first one is, should we do anything with this lady? She's only been trying for 6 months. The medical definition of infertility is 12 months. Now, there are a few GPs out there who will say, look, she's not been trying long enough, just keep on trying. Now, I would say this boat's about to sail. In fact, it probably already has sailed. And I think I would say any woman who's 40 plus, we have to be quite aggressive in our investigation and management. So I would say, look, yes, we do have to jump in with treatment. And I think even though IVF is not a fantastic treatment, I still think it has some value, and I'll touch on that in a sec. Now, this graph on the left depicts the pregnancy rates in IVF throughout Australia and New Zealand a couple of years ago, the last report. And you'll see that the chance of having a live birth in a woman of 45 is 2%. Okay, so it's pretty dismal. And you might say, well, how can we justify using public money on a fertility treatment where there's a 2% chance of success? And what I would say is, look, I think IVF, even if it's not successful, still has some therapeutic value. Because I can say to a lady in my room, look, 45, I've had only, a dozen pregnancies in 15 years of IVF practice, it's not looking good. But they always think, oh, it doesn't apply to me. It doesn't apply to me, I'm healthy. I go to the gym 3 times a week. And until you actually give them maximal dose stimulation and show that their eggs are not good quality or their embryos are not good quality, they don't understand that. So even if they don't get pregnant, they actually get to see this. And that's quite good for closure. And it's not only does it give them the opportunity to say, look, I tried, I did my best, I can't move forward, I'm just going to give that up, I'm not going to have any more treatment, but it also gives them the opportunity to move to donor egg, which Emma's going to talk about. So, and until they've given it a go themselves, very few women will be happy to move directly to donor egg. That's just the reality. And I would say, look, isn't it reproductive justice that a woman of 45 years of age who's paid taxes for 25 years should be given the opportunity, at least one cycle of IVF, to give it a go? She hasn't had children, costing the government money for school and such. I think we owe her that much. I don't think we owe her 15 cycles of futile IVF, but I think we at least owe her one go and see how she goes. The last bit here is the risk. We have to consider another individual in this equation, and that is the child. Is it ethical to treat a 45-year-old where the risk of a live birth, if she doesn't terminate, is 1 in 30 of Down syndrome? It's a reasonable question. It depends on, I guess, what her position is on termination of pregnancy and screening. But I would say we do have the options of pre-implantation genetic screening, where we can actually test the genetics of the embryo before putting it back. We have the Harmony test, etc. We have some options, but it needs to be considered in the equation. Okay, my final slide. How do we reduce the number of Marias? And I think this is really the critical question here. Okay, unfortunately, I think the boat probably has sailed for Maria. But how do we stop there being lots of women at 45 looking to have their first child? I think we acknowledge that women are not going back into the kitchen and becoming housewives again and having children at 23. That's not going to happen again. Women want to have a career. We have to look at other options. Some of those options might be things like egg freezing, egg banking when they're young, so they can use those eggs later. It might be to look at more flexible work conditions, so it's easier to have children and have a career when you're younger. And then finally, an area close to my heart is the egg timer. This is where we screen women in their early 30s to see what their ovarian reserve is. And I find that it gets back to this issue. A lot of women think it won't happen to them because they're healthy, mum had 3 kids, blah, blah, blah. Until you test them and show that their result, their egg count, is low for their age, they're not willing to make that decision to have kids. Sometimes having that hard information that they're in the 10%, the lowest 10% in egg count, will help them get across the line and make that decision. So I think it's got to be a multifaceted approach. So is older better? Are women like wine that get better with age? I'm nervous in this audience, I must say, to give the answer to this. Look, I think from a reproductive perspective, unfortunately, women do not age well. Biology is not politically correct. We are ideally meant to have our children in the 20s and maybe early 30s, and I think we have to recognise that and look at other solutions to this particular problem. Thank you very much.